How to get rid of cholesterol bumps on eyelids. When you have a lipid disorder, it can cause havoc with your health. One of the common developed issues from an out-of-control lipid disorder is xanthomas, or cholesterol bumps around your eyes, which medically go by the name of xanthelasma. One of the main causes of xanthelasma is high blood pressure and high cholesterol, but it can also be a consequence of other factors such as diabetes, heart disease, cancer, diabetes and heart failure. People with high cholesterol, cirrhosis of the liver or diabetes have a higher risk of developing the problem. It is more common in people between 40 and 60 years of age, but can also cause problems in the senior population. Luckily, most people with xanthelasma do not have high cholesterol or fat levels, which could put them at risk for heart disease, stroke, diabetes or other health problems. Small studies suggest that it may even be a sign that your cholesterol is normal, so make an appointment with your GP to see if you can prevent it. About half of patients with xanthelasma have elevated lipid levels, which are often associated with high blood pressure or high triglycerides or inherited. Finding out how to get rid of cholesterol bumps on eyes. Firstly, getting your cholesterol levels down will have a profound effect on your xanthelasma. As your cholesterol levels come down, your xanthelasma will slow down in spreading and hopefully will stop completely, leaving you just with the remaining xanthelasma plaques. These plaques don't go away on their own and so will need treatment. There are 1 or 2 treatments that will remove them once and for all, but most of the other treatments touted by beauty parlors and the likes have a very well documented history of creating more issues with your xanthelasma than you started with. Take lasers and electrolysis and even cryotherapy as examples. They all have the same effect on the skin, the xanthelasma, and we will now explain why they all create even more xanthelasma after each treatment. You will end up continually chasing the plaques all around your eyelids, each time they get harder and harder to remove. The above treatment destroys the cell walls of not only the xanthelasma, but also the healthy cell walls that are next to them. So, you now have a healing mass of structurally defective skin cells. Nothing has been specifically aimed solely at the cholesterol, but the whole area. This will mean that when the areas heal, the areas furthest from the treated area are healing as a combination of healthy skin cells, mixed with cholesterol. These will now create even more xanthelasma. But as the area was affected by a trauma, the skin will now protect themselves with a keloid, scar tissue, so they now become even harder to remove. This is clearly evident in people who have had laser or cryotherapy treatment on their cholesterol bumps, as there will be a crater where the initial treatment was and a ring of hardened xanthelasma on the outside. Getting rid of cholesterol bumps on eyes. The 2 definitive techniques is a product called XANTHEL, which targets just the cholesterol cells in surgery. One is surprisingly affordable, whilst the other one, with scalpels and doctors and more, is very expensive. If you want to find out even more information on your treatment options for getting rid of cholesterol bumps on eyes, then go to xanthel.com or xanthelasmatreatment.com.